Brockton Neighborhood Health Center means a lot to me and my family. We're able to come here, feel safe, and get all the help we need.
It's been a blessing to me and my family.
They helped me when I was the worst time of my life. Homeless, no food for my kids. It's a wonderful place to be and work.
Brockton Neighborhood gave me hope, and they gave me my life back.
Well, we're a federally qualified community health center serving about 23,000 patients, about 130,000 visits a year, and we provide primary care medical services, dental services, social services, psychiatry, and a variety of other services, primarily for low-income, diverse patients.
I think the New Market Tax Credit Program is one of the best things Congress ever did. It is specifically targeting equity investments to low-income and underserved communities. And a city like Brockton, where the average poverty limit reaches over 30% of the people, is desperately needed.
Primary health care was a huge gap in the Brockton community. We were at the time the only city of our size in Massachusetts without a community health center.
The growth of this health center is a tremendous story. Under Sue Joss's leadership, I mean, they basically went from a minivan that was providing health services in a church parking lot to a $22 million facility.
Without the New Markets Tax Credit, I don't think Brockton Neighborhood Health Center would be here in the form that it's in now. It took us about 7 years to get financing for this building.
As we started underwriting, we had an appraisal done on the project, and we discovered that we had a nearly $5 million gap. It's great to be able to bring a tool in like New Markets Tax Credits, because you can bring in equity to a project that normally community health centers wouldn't have on hand.
What we love about New Markets Tax Credits is that they're really interesting mechanisms to work with. They're very complicated, they're very involved, and they take a level of expertise that not every lender has.
And we really need to rely on a partner like Reznick to help put together financial projections that everybody can understand and we know are going to be accurate, especially after closing.
We love this type of a project. It really gets us excited. We really can see the impact of the work we do.
So it's also a great way to introduce large financial institutions to the strength of community health centers and their viability.
What I often tell people is that what we help these projects do is have the quality of the facility match the quality of care.
Brockton Neighborhood Health Center has had a tremendous impact on the community because of the way that we've transformed health care for all of our patients.
So whether you're insured, uninsured, partially insured, it doesn't make any difference to us. We serve the community.
Health center projects in general mean a lot to the community because people have access to health care that they would otherwise have to travel to get to.
From an economic perspective, the health center is also really important to the community. We are now the largest employer in downtown Brockton. More than half of our employees live in Brockton, and this is the entry-level job and the first professional position for a lot of our employees.
One of the things we do is we give workforce development grants, and that to me has been really important because we see them moving and growing through the health center.
I started at the health center at the age of 15 as an intern, and I grew up through the health center, so I saw the health center grow as I grew.
I'm here working, go to school. I got a house now, got my car. You know, I take care of my kids.
This place has given me the opportunity to show my young children that, you know what, mommy can do it, and this place has helped mommy along the way.
I couldn't done it with Brockton Neighborhood Center. I couldn't done without.
It's given a lot of jobs to people who wouldn't have jobs. I'm actually hiring as we speak now. So it's been a great help to the downtown Brockton. It's got the bad name out of Brockton.
It's been a revitalizing force on Main Street. It is the largest employer.
We employ over 300 people. We generate a payroll of over $16 million. A lot of that money is spent right here. And at this point, we probably anchor this whole block in terms of all the small businesses you see.
The economic impact is huge in terms of local businesses, and it has been the catalyst for additional development in the surrounding neighborhood.
We are are a community. We serve the community, and that is at the heart of our mission.
The first few weeks in this building, we had patients walk in and look around the beautiful lobby, the spacious area, and several patients said, wow, somebody must think we're worth something. And that's really what makes it all worthwhile, and that's why I do it, that's why we all do it.